All right, now it's time to start documenting what Trump and his administration is doing to dismantle the CDC. This here is a Forbes article. The title is Trump Administration Lays Off CDC's Epidemic Intelligence Service Workers. In the article, this is going to be abbreviated EIS, and they're threatening science and public health. So, starting off, the impact: over 1,300 probationary workers at the CDC are being let go. This represents about 45% of all probationary workers at the CDC, where the reasoning behind these layoffs are supposed to be to curb inflation and increase government efficiency through cost-saving measures. So basically, they're just firing people to try and save money. But the thing is, when you fire all of these people, you're not increasing government efficiency, you're actually decreasing government efficiency, especially with disease surveillance, because you need all of these people to actually run the operation efficiently. Now, what were these people even doing? Well, the Epidemic Intelligence Service people, they were responding to public health threats such as E. coli and cholera. They actually helped contain the Ebola Nigeria outbreak from 2014 to 2016, and they also investigate the source of many foodborne illnesses and outbreaks in America and throughout the world. So when you're hearing about the salmonella outbreaks or the E. coli outbreaks and things like that are happening pretty consistently these days, that's them. They're catching this and fixing it oftentimes. If it's not actually being like caught by like the FDA or other agencies, they're shutting this stuff down at the source. That's their role, to identify it and then troubleshoot and solve the problem. Now, this part of the article is the part where I'm actually the most concerned, in that it hinders disease surveillance. The people within this office have historically identified and controlled important health threats like COVID and the Zika virus, meaning that these are the people that identify the threats and come up with the initial response to how to deal with it. And this would be very important with things like bird flu, which is just around the corner, it feels like at least. But COVID is still ongoing, so they're kind of needed for that as well. Furthermore, eliminating these people compromises the data analysis that they were doing. So these people play a vital role in gathering and interpreting scientific data, which often informs public health policy and the allocation of life-saving resources. So with fewer manpower, with less people, there's less resources to distribute all this work evenly so that it is all addressed in a timely manner and it is all done thoroughly. This means that the quality and timeliness of the data is going to be hindered, very likely, and that is going to result in suboptimal responses to emerging health threats like bird flu, where ultimately these cuts to healthcare personnel are a threat to public health and safety. Because without this group of people, America is going to be less prepared against future global health threats, in addition to the ones that are happening right now.